Dear Chairman, dear colleagues, ladies and gentlemen, today I'm proud to present results on health-related quality of life after open and laparoscopic liver resection. This was a sub-study of the randomized Oslo-CoMet study. Laparoscopic liver resection has been implemented more slowly than other laparoscopic procedures, partly because of the complexity of the operations and the need for skills both in liver surgery and in laparoscopy, but also because data from randomized trials are lacking. 2 consensus conferences have been held in the US in 2008 and last October in Japan. Although the consensus last autumn was that the pioneering days of laparoscopic liver surgery now is over, everybody still agreed that more data are needed, either from RCTs or from large systematic registries. On quality of life, the consensus group concluded that very little comparative research had been done and recommended that high-quality studies should be performed. The aim of our study was to compare health-related quality of life in patients randomized to open or laparoscopic liver resection. This is a predefined, detached sub-study of the Oslo-CoMet study. The CoMet study is a single-center randomized controlled trial comparing open and laparoscopic liver resection for colorectal metastases. As of today, 218 patients have been included in this trial. The primary endpoint is 30 days complication rate measured by the accordion system and the CCI system. The study protocol was recently published in Trials, so you can download it and see if you have any more questions about the protocol. In this study, we used the short form 36, a generic quality of life form that is validated as a measure of post-operative recovery. It also provides data for health economic analysis, which is one of the main reasons that we chose this one. The results of the SF36 can be summarized in a mental score and a physical score. Patients receive the forms in the outpatient clinic before surgery and at 1 and 4 months postoperatively. Statistically, the groups were compared with a linear mixed model that included data on adjuvant chemotherapy, as this will influence the quality of life after operation. Between February 2012 and March 2014, 128 patients were included and randomized to open or laparoscopic liver resection. The reply rate in this study was 86%, and we analyzed 330 forms. All patients had colorectal liver metastases and underwent parenchyma-sparing liver resection. And we defined this as resection of less than 3 consecutive segments, although more resections are allowed in one patient in one procedure. At baseline, the groups were similar. 4 patients in each group were operated with a liver-first approach. These are the results for the mental component summary. On the x-axis, we can see the score, and a higher score represents a better mental quality of life. And on the y-axis, sorry, and the x-axis is the time frame. The patients in both groups reported improved mental scores after 1 month and returned to baseline after 4 months. There were no differences in the change between the laparoscopic and open groups. The physical component summary has been shown to be a valid measure of both physical health and postoperative recovery. Here the groups are different. We can see that both groups reported a significant decrease in quality of life from baseline to 1 month. After 4 months, the laparoscopic group were back at baseline, but the open group still reported reduced quality of life compared to baseline. When we compare the change in physical quality of life that the groups reported, the laparoscopic group performed significantly better after both 1 month and 4 months. Today we have presented results from a randomized controlled trial comparing health-related quality of life after open and laparoscopic liver resection. More data will follow, as the Oslo-CoMet trial is expected to complete inclusion early next year. Also, the international multi-center trial, the Orange 2 Plus trial, which is comparing laparoscopic and open hemihepatectomy, will supplement this data. In conclusion, ladies and gentlemen, in our trial, patients randomized to laparoscopic liver resection reported better postoperative quality of life than patients randomized to open liver resection. We could see a statistically significant difference after 1 month and after 4 months. Finally, I would like to thank the organizing committee and the chairman for allowing us to present our results at this great meeting. And I also need to thank all these people and many more who are working hard every day at the HBB Center in Oslo so that we can do this trial. Thank you very much. Happy to answer any questions.
Thank you very much.